Welcome back, team, to Plastic Surgery Untold. I'm Dr. Johnny Franco, board-certified plastic surgeon, also known as Austin Plastic Surgeon. I have the great pleasure of being joined by our incredible team here of cohorts, and I think you've met everybody, but we'll go around the table and introduce everybody. Today we're going to be talking about the perfect lip pout, and so we'll have a little G-Berto Nurse Sarah off here, and I think they're going to lead a little bit of the discussion and the debate, and we may even have a surprise quiz for them, but who knows what will come in. But we'll start to my right here. We got Celebrity Anesthesia.
What's up, guys?
Also known as Travis Osborne. Nurse Sarah.
Hello.
Katie J.
Hello, everyone.
Our incredible esthetician. and then to my left, beautiful man, G-Berto.
Buenos dias, everybody.
Damn, look at it.
Wow.
First, Sarah, you've already been one up. Score. Not that we're keeping score, but score 1-0 G-Berto.
Okay, fine.
On the intro, so not that we'll have a grand total at the end of the day, but we will. Well, let's catch up a little bit. I know with the COVID-19 and everything else going on, life's been a little crazy, I'm sure, for everybody. And catch us up. What's been going on in your life?
Not too much has changed. Mary is getting a little bit better with her knee. I know you guys have been following along. People have been reaching out and asking, which has been super nice. She is doing better with the pain stuff that she had going. Here in a week or two, she should be off crutches completely, which will be cool. But because we weren't doing a whole lot of social interacting before that, social isolation hasn't been too bad with the coronavirus. So not a huge change at our house. But been trying to not go out to huge events and big things, but not that there's much of that going on right now at all.
I'll tell you, this was my weekend off, and and I think for most people to understand, the people in this room are not gonna have some really bad effects from this, but we could be carriers, we could distribute this. For sure. I'm so afraid of being locked down into quarantine that it was my weekend off, and I avoid large crowd areas because I don't want to be, part of the problem. And
Totally.
so I think just being responsible.
I think it's a social responsibility at this point.
Can I tell you, can we digress for a little bit about social responsibility? This is just a personal plug. You guys don't need 16 months worth of toilet paper stocked at your house.
Gosh.
There's a little social responsibility. You don't have to get both armfuls full of cleaning supplies. Like I promise, like this is gonna come to an end. It's gonna get better. Get what you need, but be a good neighbor, please.
We real quick story on this. The other day we get groceries like normal people, like for maybe a week or two
not
at
for
a time.
a week at a time.
A week at a time, and I went to Central Market because, like normal people, we had eaten through most of our groceries.
Normal people don't do all their shopping at Central Market or Whole Foods,
right.
but for the 1%ers out there, please continue so we can live the celebrity anesthesia life. Please continue. I mean, for those of us at Walmart, let me know how the 1%ers live. Thank you. Thank you.
Or Fiesta.
I do a little Fiesta, but no, please continue so I can have dreams and aspirations of the anesthesia world.
I knew I was going to get flack for that. Anyway, so I went to Central Market the other day, and we are looking for sponsors, by the way. If Central Market wants to reach out.
That's how we know it.
So, or Whole Foods. I'm not going to discriminate. Anyway, so I went there to just get a couple things. We need milk, groceries, eggs, blah, 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 whatever. And I walk in, and I'm talking with my mom on the phone on my way in, and H-E-B is a big chain in Texas, and Central Market's kind of their Whole Foods version of it. So I'm walking in, and I'm talking to my mom. She's like, hey, the other day I went out, and I was trying to find stuff. It looked like the end of the world. Like, there's nothing on the shelves. I was like, I doubt Central Market's going to be like that. It's kind of like Whole Foods, very boutique-y. So I walk in. The entire produce section, all they had was pineapples. The entire place, like salads, vegetables, anything, all gone. I called Mary and was like, hey, so that list that you gave me, we're getting like 3 things on it. There is nothing here. I just thought it was absolutely hilarious. Like, everybody does not need to get, buy greens and spinach for the next 6 months. Mm-hmm. Please leave a couple on the shelves just so that I can make, a salad.
They don't even keep for like 2 weeks.
I know, right?
I mean,
like, what do you guys need
pineapple is one of the things they should have gotten. That's bromelain. It's healing. It's really good for you. And
yeah, you don't want bruising after your lips.
Like, actually, go get that pineapple. Actually, that's the plug.
The best part of that entire shopping experience, I'm ready to check out. There's a guy behind me, I don't know, 50, 60 years old, and he coughs. And I swear, the lady behind him looked at him like, oh my God, we're going to die. We're all going to die. And I just see this like panic over this lady's face. And the guy was coughing. I mean, normal people cough. Like it was not a COVID-19 cough. And he just, and she was like, next line. She moves her cart over and goes to the next line. I was like, oh man, we're living in a new time.
Interesting times
Oh,
for
yeah.
sure.
But what's going on in your life, G-Berto? I feel like we haven't gotten an update, nothing. I mean, I do love that every time I reach out to G-Berto, he's like, oh, I'm at this party. I can't go tomorrow because I have this thing. I was like, oh, I guess my invite got lost in the mail. Must be problem with the mail in my phone.
Yeah, I kind of picked up on that a little bit.
Okay. So tell us about the parties that Celebrity Anesthesia and I didn't get invited to.
So most recently, my girlfriend just celebrated her 30th birthday, and so we had a big party for her.
And tell the audience, how old are you?
Age is just a number.
You're 33. You're 33 and you're 33.
I'm 30 plus.
Okay.
30 plus. That's a good way to put it. That's what I
That's
say.
cool. Women like older men. You're still good.
But I didn't plan the party.
I mean, but I still think she falls in the half your age plus 7, doesn't she? I mean, it's right on the fence. Close.
I think we're
maybe.
good. I think we're good. It's just a solid half my age plus
okay.
7. Yeah. So I didn't plan the party itself. It was like a dinner out and then gathering. It was one of her best friends, and she got all her like high school friends together. I think I got lucky to get invited into this event.
Well, somebody had to pay for the party.
Yeah.
I didn't see it that way. But now
It sounds so different when you say it like that.
that's a little more hurtful.
About this conversation.
He just had a whole epiphany.
I
Look at
just
his
felt
face.
so bad. I just saw his face and I felt so bad for a moment.
That's a little more hurtful, John.
Well, if I got an invite, I probably would split the bill with you. But boom, boom, boom. Lesson learned.
But I did kind of plan some stuff for her on my own at home.
That's sweet.
I like the morning of, I got up a little extra early and blew up some balloons and put up some banners and just kind of decorated my condo for her so that she could wake up to like this really festive.
Damn.
Okay.
I feel
hold
like
on.
it's these little nuggets that make you Austin's most eligible bachelor. I hope that some of you ladies are trying to slide into this DM because
I'm trying to
G-Berto,
slide it at
damn,
this point.
you're
Like,
not
what
just
the
a beautiful
heck?
man.
Accepted.
You're an incredible man.
No.
Damn.
I'm going to slide
Damn.
right on into this.
I'm gonna have to up my game
I
at the
hope
house.
Mary, at your
Yeah.
trendy therapist, is watching this so that the bar has been set so high for Travis
Oh my gosh.
that he'll be sleeping on my couch after Mary's birthday. So, at your
sure.
trendy therapist, please take notes. Set the bar very high for Travis.
That's
It
at
was
the
a
bar
special-
so high for the world right now. I
It was
feel
Yeah.
a special birthday. You know,
Damn,
had-
yeah, I
had
mean
to,
that
like-
that 30,
Oh, that's
that 30.
sweet.
Gosh, life's half over.
And I didn't
never
get
recovered
to
after
plan the
30.
dinner, so I figured let me do something a little nice for
You're
her.
you're an incredible man.
You really are.
And anything with our lovely ladies here? Anything new and exciting going on in your lives?
Katie?
Yeah, well, you know what? Everything is exciting when you're in our life. No, I had a great time this weekend. I did kind of keep it chill, but there was some fun like house parties. People were like doing like, hey, if you want to come over, I've got hand sanitizer. We'll play games inside, and it'll be a fun night. And that was fun. So I did that, but I'm kind of boring compared to
Yeah,
like
I've
what
s-
just happened with his.
Yeah.
Yeah.
I have some friends in from out of town. We're just going on a little Austin food tour and keeping
Is
it chill.
this the out of town boyfriend?
No, this is one of my best friends.
Is this a
Fascinating.
different man?
This is the
No,
in-town boyfriend.
I don't have an in-town boyfriend.
No.
The out-of-town boyfriend is still out of
I'm
town.
kidding.
This is one of the 20-year besties.
don't you typically say that as long as they're out of town you can have an in town? Is that what you
In
is that what
theory,
you say?
that's the
Is that what you
idea,
say?
but
I
Do you want to
feel-
give him a shout out so he can listen, so we can tag him
no,
on this
no,
post,
no,
and
this
so
is-
he
this is
can
getting off.
he can hear about the in and out of town. So
You said Austin food tour. Where'd y'all go?
so obviously Torchy's. The Grove is by my house. I actually
Okay.
like that
Yeah.
for a
Me
brunch
too.
option. They do a good $15 champagne bottle with all the flavors.
There
if
you
you're
go.
looking for something
Little plug
good.
for the Grove. Right
Yeah.
Also, the Fairmont Hotel. I did whoop it up at brunch yesterday. The Fairmont was very quiet, but I will tell you what, that's the best brunch I've ever had my entire life.
Really?
I'm
All
gonna
possible sponsors, by the way.
honestly, I'm not joking. They give you. There's rooms upon rooms of food, and you're just like, this cannot be. Let all the dessert I've ever seen and all the things. And then they give you a sheet of paper, and they're like, you can order one of all of these if you want. And I did. I ordered one of everything. They keep just bringing it to you like a, Brazilian steakhouse, and you just keep getting all this stuff, and then you can still go into the room and get all the things. It was maybe the best brunch of my life.
Oh, man.
There was a band playing. I ate like a princess. It was a great day.
I mean, one plus is it's much easier to get reservations in Austin the last week or two. So, I mean, I'm not going to complain. But because producer Donald's tapping his watch again, for those of you that listened to the last episode, let's get into a little bit of a lip craze here. And so I know that we've talked about lip augmentation in general, but we got such positive feedback and we got so many questions. And Nurse Sarah says that this is her specialty. And those of you that follow us on Instagram probably agree. We're going to talk a little bit about what the perfect lip shape is, but just so that we know who to listen to, whether Sarah or G-Berto, can we start off with a little quiz here?
Is this a lip off? Our first
maybe a little lip off.
Lip
First
off?
official lip off. So let's do a little lip history to make this fair. Okay.
Alrighty.
1 point to the answer. Buzz in. Travis will be the official generator of who raised their hand first.
Yes.
Can I get a 2
What
for 1 special
is-
Canadian idea?
What was the first lip filler ever used?
We talking about type or brand or
If you know the answer.
Throw out an answer.
Nobody?
I was just
Nobody?
saying
You guys are-
injectable fat.
I think it was
I
fat.
was gonna say injectable fat.
Boom, boom, boom.
Oh!
Fat was the number one. Question number 2. Score is now 2-0. G-Berto. What was the first man-made lip filler?
Collagen.
Minus point. For the steal,
Hyaluronic acid.
hyaluronic acid is actually a very recent filler. Paraffin was the very first in 1906.
Did not know that.
Wow.
Was the first time it was used and described.
I did not know that.
It was an epic failure. So please don't ask
There
for
was
it.
no more.
Question number 3. What was the next filler described after paraffin that people used for a period of about 20 years and now is only illegally done in the United States?
Silicone.
Silicone. Boom, boom, boom. We'll give you each a
Yeah,
point
that
for,
was
for
a
this.
tie.
Why? Last question. What filler was used before hyaluronic acid, and what is the huge benefit of why we use hyaluronic acid and not the filler that it replaced?
Well, I mean, the huge benefit is that it's reversible.
That's a good one. There's another one. What was the filler?
Yeah.
Part 1. What was the filler before hyaluronic acid that was commonly used worldwide?
I mean, I'm going to say collagen again.
What kind?
Bovine.
Bovine collagen.
Ah.
Bovine collagen. And what was the huge problem with it?
Reactions.
So you had to do what?
It's a test.
Yeah.
Nurse Sarah, you're being awfully quiet. What's going on?
I'm
with
learning my facts.
So with bovine collagen, the problem was that people had to be tested
Yes.
ahead of time, and so it was in this day and age. We were talking on a previous episode about online and this Uberization of plastic surgery, and here in the past with the collagen stuff, people could have reactions to it, and so they had to come in weeks before and get tested and then do it. Now with hyaluronic acid,
Boom,
this
boom,
being a
boom.
natural occurring product in your body. People can come in, get it done the same day. There's no testing. I think one of you mentioned that it's reversible, which is a huge plus. So if people have something, if they don't like, they can reverse it. But I think both of you can attest that the times that you actually reverse an injectable is extraordinarily rare. Extraordinarily rare. But to the last point, and the reason for the history stuff is be careful what you're getting injected. There's a few very quality products out there done by quality providers. There's a lot of cheaper stuff done in hotels and other things, and literally done in hotels and other back alley type stuff. Be careful what you get injected. The reason silicone and these things had problems is they looked good initially because they cause this intense inflammation. The problem is they're not reversible.
Right.
They don't dissolve. They don't go away. If you have a problem, it's a bad problem, and it's very, very difficult to see. I saw a lot more of this when I was in Miami than I do here, but you definitely see a little bit. So
I've even heard of cosmetics being done like on cruise ships and stuff.
this is
Really?
true.
Interesting.
This is true. The laws in terms of who can do injectables in a cruise ship that gets into
In
international
international
waters
waters,
is very, very interesting. And so
Interesting.
maybe a topic for another day, because I actually know the man who started the company that did did the
Really?
cruise ship stuff.
Interesting.
He was actually part of my practice in Miami.
Wow.
And so, topic for another day,
Yeah.
but a good topic.
More history
so
here
I
on Plastic
I
Surgery
liked
Untold.
it. I liked
So
it.
I hope you guys it's just the reason I wanted to bring in a little history is I don't think people realize we take lip augmentation and fillers for granted. I don't think people realize the evolution, how complex, how hard this is, and how much has gone into development and where we're at. With leaps and bounds from the old days of trying to like melt paraffin and put in these steel, syringes to fill up lips, which is an epic disaster. And so now we have these quality hyaluronic acids. They're reversible. They're shaping different volumes, different size. So Sarah, maybe kick us off a little bit. This was your choice to do a little the ideal lip. So talk to us about the ideal lips, because I kind of feel like I have the ideal lips naturally, but you may disagree. So let's go.
I think a lot of people would actually agree with you.
Yeah.
In the office, you get eyeballed a lot for those lips.
Damn.
Yeah.
So are you saying that maybe I'm the most beautiful man and not G-Berto? Because that's what it sounds like.
We could
you're
do a
saying.
vote. We could
He's
do a vote.
not going to be able to walk
Side
out of
by
this
side.
room. His head will get stuck in the door. Do not keep this up.
If there's anyone who I would gladly pass that crown on to, would be you, John.
I'm gonna say that to
wow.
Gossip Greg. He is not gonna be happy with you.
Beautiful man. He's,
Yeah.
he's the most eligible bachelor. It's 2 different crowns.
Yes, that is. 2 different categories.
You can't go for the triple crown yet.
Yeah.
I only have one head. It's too many crowns. I don't know.
Talk to us a little bit
Yeah, no,
about.
I think lips is a super popular, obviously, procedure. Probably the most popular thing we do in the office outside of Botox, Xeomin. Jaw lines kind of creeping up for top of the line there too, as well. I'd say.
You refer to episode 11.
Yeah.
Jaws the new
Yeah,
lips.
yeah.
But continue, please.
But yeah, I think everybody's, for the most part, it's a really good candidate for lip filler, one reason or the other, whether they're trying to work on some fix of like some asymmetry, whether they just want a little bit more volume, or whether you're like Katie and I and like 5-6 syringes and that really nice pout. So I think everybody can benefit from it one reason or the other. But I think going into it, if you're coming into the office for lips for the first time especially, is a really, really good quality consultation, because the perfect pout and perfect lip to everyone is completely different.
Absolutely.
I think.
And I think this is where the paradigm has changed. I think when lip filler started coming, we didn't have the fine products and stuff that we have now, and the tiny little syringes. We just added volume. And now I would, and I'd love to hear your guys' thoughts on this. I feel like there's been a real paradigm change in terms of, trying to shape the lip and not just volumize the lip. Thoughts about that?
Yeah.
So I think 100% that's kind of shifted. I think before, even maybe 2 or 3 years ago, the craze was let's get these lips as big as possible, and I think we have social media to thank for that.
You're welcome.
maybe one or 2 Kardashians for that.
Yeah.
But I couldn't agree more in that I think now it's more about being a little bit more subtle, a little more natural, but giving the lip that ideal shape.
Yeah.
What are some things that you look at in terms of ideal shape? What are stuff that you try to create, stuff you talk about, stuff that maybe you look at when you're doing these consultations? Because there's things that you can improve, things you can't, things that take time.
So essentially when I go into a consultation, I look at a few things first. Initially, have they had filler before at all, and what type of filler have they had? I think that plays a part into how you can shape the lip going forward, and just knowing what products they've had in place. But as far as the actual consultation itself, I think to focus on the Cupid's bow, any asymmetries that they have, and then the actual how large they want their lips to be, I think are the 3 points that I hit on most. Initially fixing asymmetry, sometimes I will tell people, let's fix the asymmetry first, kind of get you balanced, and then come back, and then we can work on a little bit changing of the shape or volume and things like that. So I think just addressing how they see it versus how you see it and coming up with a really good game plan.
Can we talk a little bit about size and lip flip and then vermilion show? And so when I talk about vermilion show, the other term I like to use is red show, because a lot of times one of the biggest things that I get from patients is they want more red show. They want kind of that luscious lip, and the lips just tend to hide and disappear. And so I think, and I don't want to take credit for this because I actually listened to somebody else talk a couple years ago about how it takes time to stretch out the lips. And can you guys touch on that? Because I think, people have to realize they can't come and say, here's $1 million, I'll do whatever fillers I want, but there's still a limit to where you can get people in one setting.
For sure.
Right.
I typically don't do more than a syringe at a setting. What about you?
Yeah, typically not more than a syringe, just because it can be pretty overwhelming for the patient initially to kind of go from, you know, not having that much volume at all to having a lot of volume. And oftentimes they'll call and say, look, I don't know if I really like this. And I tell them, I just reassure them, even before they leave the day that we do the procedure, I'm like, this is going to swell. And it's going to look a lot bigger than what it's going to end up looking like, at least for a couple of days. The more you ice, the lips, the faster you're going to see that swelling go down. And then that kind of gives them a better understanding of what kind of expectations they should have.
Because I feel like if you try to just overfill, they get this very hard, fake appearance. Part of it is stretching that skin. And if you look back at other plastic surgery procedures like breast reconstruction, there's a reason that we use tissue expanders to shape. You know, the biggest thing was always expanding that lower pole. You could just stick a huge implant in, but it'd be really tight. And I feel like some of that, you know, we kind of, for some reason, just ignored in the lips. It's basically stretching that lower portion of the lips to get that to roll on out. We now also incorporate some Botox and other things to do this.
Yeah, and I think to your point, another really great benefit of doing the tinting on the top to get the lip flip is that you don't have to put in a whole syringe of filler on the top. If you strategically can place that and get that lip to flip up and get a little bit more red show, they get the bigger appearance without the duck lip. Right?
Can we talk about a few specific technique stuff? Because I feel like you see these on Instagram, you hear about them, and I think for people like Celebrity Anesthesia and myself who have naturally perfect lips, you know, these words are foreign to us a little bit. But let's talk about the lip flip, because I know we hear about it. Can you guys maybe tell me in each of your practices what that exactly means and how you do it?
In my practice.
Yeah, can you share your little nuggets with us?
Sure.
Is that okay?
Yeah.
You don't mind sharing with the world?
No, yeah.
Okay, cool.
I'm all about, you know, educating the masses.
Damn, thank you. For those of you just listening, I'm taking notes right now.
In my practice, the lip flip is utilizing Botox right at the vermilion border to kind of help relax that orbicularis oris muscle so that the lip can kind of give that little outward curvature, showing a little bit more of the red. And in some cases, you can even help minimize the appearance of some of those vertical lip lines that people get that they may not like. Quite honestly, I was doing that long before I was doing the lip flip Botox approach. I was, you know, I was getting patients to come in asking me to help them with their vertical lip lines from either just extensive sun damage, or maybe they were once smokers, or maybe they, you know, drank out of straws a lot throughout their lifetime. But it's that puckering movement that the orbicularis oris muscle makes that creates a lot of those lip lines and exposure to sun radiation.
I love the Botox for the vertical lines around the mouth. I think you got to be careful because it can change people's smiles or they can feel a little funky, but I think it gives people a nice natural look and settles those down. Sarah, lip flip to you?
I agree. Same thing. And a lot of people, myself specifically, I liked it because I have smaller teeth. So I think that's kind of where the consult comes into play. Sometimes it's not that somebody wants these gigantic lips. They just want to have a little bit less show of their gum line and things like that. So I think, you know, all of that is a really good benefit.
How about lip tinting? Do either of you guys do that? And can you explain what that is? Because I think people online used to think I was saying tinting, like we were painting people's lips. It kind of looks like that because they got more red show. But what are we really doing with that?
So we go in through the top, and I don't know how many injections you do. Typically, anywhere between 4 and 5, kind of on each side. Put the needle in, and then we just pull back a little bit to just provide like a little pillar almost to help that lip stand up.
So for me, it's patient dependent, you know, and some of that may even go into, you know, the patient's age, their ethnic background, because you know all those things are things that I feel are important to take into account when you're trying to.
How long are your consultations? 2-3 hours?
No. I'll consult with a patient maybe about for like 15-20 minutes, just talking about the procedure itself, and then I'll inject after that. But I do tend to block out at least like 45 minutes to an hour for a filler, which and for me that's what works. I don't know.
Okay.
But to Sarah's point, I think it depends. I really don't keep count in terms of how many, you know, supporting pillars I inject through the vermilion border when I'm doing this lip tinting procedure. But I will say that it is something that I have kind of adopted into my practice a little bit more recently because I think it's what patients are looking for.
I think it can be super powerful. These are basically like struts or columns, are basically supporting the lip to rotate it and keep it out. And this is where I think doing specific techniques like this is going to help stretch the lip in the proper shape. And this is where, again, just blasting the lips isn't going to help stretch in the right direction. And it's just like, again, if you look back at other procedures, you know, putting your tissue expanders down at the bottom, special expanders that are made specifically to stretch the lower pole, that's what you're doing. You're trying to stretch the red show. You're not trying to make them overly duck and get stuff up high and get this to sit into a good spot. So I think that's super. And you even do a cool technique where you lay people down. Is that correct? So you get a better angle at this?
What I do is I lean them back and I actually inject from above them so that I can kind of have a little bit better control of my syringe and see exactly how things are kind of developing. But throughout this whole process, I'm kind of going around, sitting them up again, taking a look, making sure that everything is as it should be. Kind of similar to what you do with your breast augmentation patients.
Yeah, send them up, checking, reevaluating, and then proceeding.
Mm-hmm.
What about this whole keyhole pout? I know that's something that super popular, that caught fire. I've seen all sorts of crazy things, and if you guys do this, then it's not crazy, it's cool. In terms of doing stuff like dental floss and things like that for the shaping, I honestly don't do that. I think if you're really precise when you're injecting your filler, I don't think you need that. I guess if you're just blasting stuff in, then you can use some barriers to try and overly create stuff. I
don't know how effective that is. I mean, I think it's kind of like trendy, you know, and you see a lot of it on social media, but I don't know that it actually does a whole lot. I mean, I think if you just, like you said, perfectly place the filler in the pillows of the lower lip, then you can create that keyhole pout without having to use any kind of props. You know what I'm saying?
I feel like it gives a false sense of where the lips are going to be because you're creating a false indentation that looks great for the 2 seconds on Instagram, but long term, I don't think it changes anything.
I agree. It's not something that people would do the dental floss in between the bottom teeth.
I've seen
just
ribbon
pull it down.
and
I think, and again, I think that a really good consultation of what the patient's looking for, you know, they may not want this big keyhole. They may want them to be even, or they may already have it if you just inject in other areas. Once you get the filler where you need it to be to improve other things, it's just naturally there. So.
And what is really the keyhole for celebrity anesthesia who's watching us here, and being you know, a little bit quiet, and I think he doesn't want to talk about his.
Get a keyhole pout.
I did.
Let's see. Put your lips together. Nope, you don't have it.
Next time.
No, just when people relax their mouth, they just have a small little tiny
opening
in between the two lips, and it's a subtle, sexy, more look to the lip.
And again, goes to breaking up the lips of not just having an upper and lower sausage across the lip stuff. You know, go ahead.
I think that Sarah's touched on it a couple times, and G-Berto has too, but this is the importance of that consultation. Like, you're actually trying to figure out, okay, they come in and they say they want their lips done, but why do they want their lips done? Is it because they don't want a bunch of their gums showing when they smile? Maybe the lips aren't the issue. Maybe you could fill 100%. Some Botox around that area, or maybe you're more concerned with a lip flip instead of actually, or some tinting like you talked about earlier, instead of just blasting and filler and getting these 2 big sausages. So I totally agree. I think that's really the take-home point with this stuff. It's finding out what is the goal of that patient.
And I think when you sit and have these consults and you're really truly listening to what they're saying, stuff dawns on them that they didn't even realize. Oh, I didn't even recognize that, or I didn't look at it that way. And so I think you can really fine tune things. And let's face it, in the face, any small change is a big difference.
And one of the things that I do too is, as I'm consulting with them, I'm observing, you know, their facial features, their animation and stuff, so I can see, okay, look, this is going on. Maybe they're not aware of it. Let me bring it to their attention so that we can maybe have a conversation about that too.
I think that's a great little nugget.
For sure. Dr. Franco does that all the time. He's preached that to me a whole lot, especially with Botox and animation and things like that. But, as far as the lip goes, they may not notice that they hold their mouth a certain way until you point it out to them. And I think it's really good to bring those things up front, because then afterwards they may look at it and think, oh, did you fill this improperly and that's why this is happening? But it's nice to acknowledge that they had it before.
Yeah.
Go ahead.
I was just going to say, just because I also work on the face and I look at it all the time. And so as I'm working with my clients, they're going to ask a lot of questions. Important to also know what lip filler can and cannot do. I'll get a lot of people asking about texture. Like they'll be like, I don't like what's going on here. So they think that if they get their lips filled, it's going to help this right here.
And for those of us that aren't watching, what can you talk about where you're pointing to?
This right here, where the lines kind of go
the marionette
down.
lines.
Mm-hmm. I can't make that face right now very well because I've got a little Botox helping me. But I'll get people asking texturally around their lips, like, oh, I feel like I've got texture, and so I think if I get my lips done, this will help. Or they'll say, I don't like these lines right here coming down, the marionette line. And then they'll say, okay, if I get my lips done. No, that's not going to help that area. And I think it's kind of important to know that texturally when you get your lips done, nothing around your mouth is actually going to change. The lines, the wrinkles, we can do a little bit, but we can't over Botox that area. We can't fill your lips and then all of that disappears. So there's a combination of treatments that have to happen, and I think that's important for people to know as well.
I think that's for the face in general. That's an incredible point because,
Yeah.
We get it from everything from facelifts and so forth.
Yeah.
You can only pull the face so tight. That's
Right.
not going to change the skin texture.
Right.
I tell everybody, you wouldn't buy a Ferrari and not get an oil change.
Right.
So, doing some good skincare,
Right.
sunscreen, other things can make a big difference.
Yeah.
Can we go back to when we were talking about the history in terms of what fillers? There's a lot of really great products out there, a lot of different hyaluronic acid fillers, but can you guys maybe tell me how you use these different products depending on the appearance that people want? Because I think there's some cool things now that we have available to us that maybe we didn't 4 or 5 years ago, how you can use different products and not one filler is perfect for everyone.
Right.
I think it depends on what the client wants. Do they want something soft and subtle? Do they want something that stands up a little bit stronger? Have they had previous filler? Are we layering this on top of another product that's in there? So, Gilbert, do you have any?
I think that there's a lot of different products out there that do a lot of different things. And, ultimately it's, like you said, just listening to what they're trying to achieve. But at the same time, I think it's our responsibility to make sure that we guide them to make the right decisions, because what they think they want may not necessarily be what is in their best interest, at least not initially. And just kind of coaching them about that and explaining, look, this filler is a really robust filler. It's a very viscous filler. It's going to make your lips really, really large. Or this filler is a little bit softer. You may not get the exact same look that your friend got just because she got the same one, You
guys are being really PC. Can we help people a little bit out there? Because we're not tied to anybody. So what fillers, like somebody's coming in and it's their first time, I want something super subtle, I'm a little nervous, I want to dip my toe. Well, from each of you guys, what filler would you recommend? First timer, want something subtle, something very natural.
Currently, right now, I would use Versa. It's a really good product that we've brought into the office not that long ago. People have been loving it. It produces a lot less swelling in that first 24 to 48 hour period. And I think once it settles in, it gives the volume that people are looking for, but in a softer way. It doesn't stand up as much as some of the other fillers. So Versa, I really like.
It's someone who's never had filler before, it's like filler naive or at least lip filler naive. I would probably do something like Juvederm Ultra or maybe like a Restylane L. It's just a little bit softer. Restylane Silk is also a really good one. The problem with Silk is that it's very lipophilic, so it attracts a lot of water and sometimes causes more swelling initially, and that can sometimes make the patients a little uneasy.
Good and bad, right? Because some people like the swelling and the fullness, and I feel like this is why a lot of people want to be bigger later, is because they liked that fullness. Same thing we get with breast dogs, and it's a little funny with the Versa. It's actually been kind of cool, and people skip a little bit of that first initial huge thing, and they almost think it didn't work because they jump right into that nice spot, and they still get some swelling, but not to the same point. But I think you bring up a great point. The Juvederm family has a large amount of products, the Juvederm, the Ultra Plus. And so I think that gives you a little bit of room to play with how much fullness you want or not.
Yeah.
And you guys can, I get criticized for this sometimes. I'll even sometimes, for someone who wants some big old luscious lips, a thing people hate about lips is having to redo their lips.
Right.
I've even done some Voluma in some lips and lasts a little bit longer. It's a little bit stronger, a little bit firmer, but gives them more volume and doing some of that. So I don't know how you guys feel about that. Other people like to just layer to I think Sarah had said this, where maybe do a Versa, do another one in a month or so before the other one wears off. And so there's different ways to get to those points. But and the reason I was pushing you guys for real product stuff is that I feel like a lot of people listen to our cast and actually looking for real direction so we can help them.
Yeah.
I know both you guys are speakers at for different companies and different things, and when we're giving speakers at speeches at meetings and stuff, we got to be careful with product names, but do whatever we want here.
Okay.
It's our show.
Yeah.
It's our show.
To kind of add to that, I think like you said, Ultra Plus, those are really great products for lips. I actually also use a lot of Restylane Refine or Restylane Define because of the technology that they use in their product, which allows for a little bit more mobility and stretching of the product, especially in areas where there's a lot of animation like the mouth or around the mouth. So I like that too. And it's a little more robust than some of the ones that I mentioned earlier, like the Juvederm or Juvederm Ultra or Silk for that matter, obviously.
And there's a little bit of spectrum. You guys can correct me if I'm wrong, because the Versa, Juvederm, Ultra Plus are in the 6 to 9 month range. The Refine Define is more in the year to year and a half range, and then the Voluma is in that year and a half to 2 year range. And then my other thought about that is that any product in the lips tends to go a little bit faster.
Yeah.
Would you guys agree with that?
100%. Yeah.
Agree. Just the talking, the movement, the eating, the chewing, you're constantly massaging that product.
All that kind of just starts to break down the product a little bit faster, cause the body to metabolize a little bit faster.
Right.
To that point, another question I get, and I'm sure you get it often too, is when can I come back for a second syringe? So someone that's new to it or someone that's had it previously before your office, that if they're looking to go bigger, they always ask, can I come back next week? And I think that's a good topic to talk on, that no, probably next week or 2 weeks even isn't a good idea. I tell them, wait, if you're really trying to get volume, at least a month, just to let everything settle, and then we can see kind of where you end up. Is that what you tell your...
I tell them, come whenever you want, girl.
You do?
Wait, are we?
He's like, I'll see you tomorrow.
Are we at the club or are we in the office? Because that was a little seductive there.
No, I think a month. I
did have a question. I know we've touched on it in previous podcasts, but when do people come in to get their lips done if they have something to do afterwards or an event coming up? If you're getting married in a month, is that okay to get your lips done before, or
I think
2 weeks, or what's my time frame?
I think a month is good.
Yeah. So it depends on the event, I guess, but I think a month would be the safest. But I'd say at least 2 weeks, because that gives you time to allow some of that swelling to go down. Any bruising is going to dissipate by then too. So.
And we almost get the kiss of death where people say, "Oh, I've come and I've gotten my lips done by you 16 times. I've never gotten a bruise."
Yeah.
And then that's the
You
day.
have just sealed your fate right there.
Yes.
For someone that is, because I'm the most lip naive, or lip injected and injectable naive at this table, obviously.
But your trendy therapist is not Botox, Dysport,
She is not Botox.
Not to call her out in front of
your
thousands
trendy
of
therapist. Shameless wife plug, number 684. But what are the risks associated to having your lips injected? I mean, I don't know.
That's a great question. There's risk for everything.
Right.
So,
Everything in the face.
bruising and swelling is a given. So I wouldn't even count that as a risk, because that's a given. You're going to get it to some degree. There's some things like arnica bromelain that you can do ahead of time.
Me too.
That helps. I truly believe in it. My dad used to be on aspirin Plavix, and when we do fillers, if he did it before, the bruising was dramatically, so I've seen it firsthand.
Yeah, so there's something called arnica that you can take in a pill form and or the gel. CVS Walgreens sells it for $7.
Yeah.
You can go there, get it. I tell everybody, when you brush your teeth in the morning, when you brush them at night, apply a little bit of gel. In 2-3 days, that bruise is gone. Cool. So,
I would say the biggest infections one you could get. Knock on wood. I've never actually seen a lip infection. I think it's just so vascular that the body tolerates it well. Something we do worry about, and this isn't just true for lips, but there's something called intravascular injections. I think, again, because the lips are so vascular, again, knock on wood, I've never seen a really bad lip something because there's so many collaterals, but something to be worried about. If people had intense pain, if they had things, we have a protocol in our office if somebody was to get a suspected injection that we treat. So I think that's the biggest thing. Again, going to a provider who, one, will recognize it. Two, if you do have a problem, and this is true for any procedure, is going to help take care of you. I'm sure you guys have a protocol in your office as well.
We do. We have a protocol in place. And oftentimes, if you do have an intravascular occlusion or injection, like you said, oftentimes you can see it like almost immediately. There's going to be like a discoloration to the lip. The patient may not necessarily experience pain right then and there, but you're going to start to see a color change to the tissue, and that's like your first clue is like, okay, we got to do something here to reverse this. Start flooding the area with hyaluronidase or Hyaluronic, yeah.
And there's a couple different brands out there, so I mean,
which is what for people?
So it's an enzyme that basically reverses or breaks down that hyaluronic acid that is being injected into the lips.
And you could use that too if I decided to come in and I didn't like the look of it.
Absolutely.
Oh man, this was I bit off more than I could chew.
As long as it's a hyaluronic acid filler that was used, then yes, you can certainly come in and
it's actually pretty
that.
Amazing to watch. It dissolves it within moments, few minutes, really.
It really does.
The one problem with it is it's a little harder to control because we've had people come in and be like, hey, I just didn't like this little spot, this little that. I typically tell people, look, it's an all or none something. If it bothers you enough where you want your lips completely gone, that's cool. We'll do it. But if to say, hey, I just want it like 3% less.
It's not happening.
Does not work that way.
And to the point, and I think you guys mentioned it a little bit earlier, is if once you do something like this, you have to give it time before you can come back. I tell people at a minimum 2 weeks, because it doesn't make sense for that enzyme to be lingering, injecting, and then it's going to be counterproductive.
Right.
Same thing about if you need to do either a touch-up or revise, or you're coming for a second. The problem is if you come back too soon, you don't know that that's swollen, if that's real, if it's what, and you end up chasing your tail, and that's counterproductive.
Right.
Yeah, and there's no way for us to tell you exactly how your lips are going to swell. So sometimes, one day post-injection, people think that, they're drastically uneven and this and that. And a lot of times if you give it the 2 weeks and it settles down, you'll see that we're very calculated as far as how much we're putting on each side and things like that. So
Can we
ride the wave?
Can we do a little key points from each of you for lip shaping, lip augmentation? Because I want to ask you guys one more question after that.
I would say listen to your patient. Just really see what they're trying to achieve and replicate that as closely as possible.
Agree. Yeah. I think to me, it's kind of more of like an art. I really have a passion for this, and I think it's amazing to be able to either, whether it's just aesthetically somebody just likes the larger, more plush lip, or if you're actually doing a correction of a gum line, of an asymmetry, that in 20 minutes you can turn around and they look in the mirror and they love it, and that's just a great thing. So
I agree with your passion. My passion is torturing celebrity anesthesia and G-Berto, which is the sole purpose of having this podcast.
Instant satisfaction.
No shortage of that.
I know, we give them plenty of material.
And I know this is hopefully, if producer Don will allow us, will be a topic for a completely different podcast itself, but since we have you both on here, maybe just a quick little summary. I think there's so many people out there doing injectables, and right now we have a plastic surgeon, a PA, a nurse, and then even a CRNA here. And so is there a benefit from one person versus the other? Is there some guidance that you should give for people in terms of doing this? Or locations where people get it, because you can get it at a derm office, which G-Berto works at, a plastic surgery office where we're at. Just some thoughts about those things.
Previously, before ever working in aesthetics, I think the biggest thing outside of word of mouth that I focused on was before and after photos. Look at as many before and after photos you can as the injector that you're looking to go see the results. Keep in mind, though, that some of them are directed by the patient of a certain look that they want. So I think being able to see that your injector can tailor that look to different people is important.
Yeah, doing your research on who you're going to go see, and if to Sarah's point, they have before and after photos on their company's website or social media or something like that, or even just asking other patients that have been to that particular injector.
You both are too nice. I'd be like, plastic surgery's king. You can only go to plastic surgery. Both of you guys are playing nice in the sandbox.
No, there's a lot of really great injectors out there, though.
I think there's a lot of great injectors, but I do think it's important to make sure that the person doing your injecting, I'll be the bad guy. I'll say this. I think you should know who you're seeing. I think it should be a credentialed person. Whether it's a nurse, whether it's a PA, it should be someone that's in a system that can be taken care of. Because we unfortunately have seen it where people have gone injected, had a problem, and there's no one to be found to take care of them.
Correct.
And so this happens if you're having a party at some hotel.
Yes.
Surprise, surprise, if you're at the Super 8 and you're having a party and you're getting injected and you have a problem a week later, guess what? You can't find anybody.
100%.
So,
Without question, though, I think you should be going to someone who knows how to manage, complications if they were to arise.
Correct.
And this becomes the whole practice where there's somebody there in terms of this, because like at our office, even if I'm out of town, there's somebody there. There's a physician who's out of town that I'm covering for the week, and that's responsible on their part, that hey, if my patients have a problem, there's somebody else. And there's obviously people that do it for me. And so I think whether it's a nurse, whether it's a PA, that they're in a system, that they have a process. We touched on it a little bit earlier. There is a system in both of our offices. We have a printed out protocol. If somebody has a problem, this is what we do. And I think it's easy to see on Groupon, here's Botox for 3 cents a syringe or whatever it is. That it doesn't make sense, because some of it is like life insurance. You're paying for something you hope you never need.
Right. Absolutely.
We have this, and we'll do another topic, but we talk about this from an anesthesia standpoint. They're paying for a service that hopefully, and an expertise that they hopefully will never need to experience.
Absolutely. Totally agree. Not somebody that's, in rural Miami in the middle of, in a back alley, and they're pushing meds that they don't understand. They're doing it themselves, or it's some dentist that's pushing drugs and then doing a breast aug under, that's not ideal.
Because like for surgeries, when they have you for the entire time. You were there. Yep. You're not going to 6 different rooms. You're not like popping in and out. Call me if you guys have a problem. Like they don't understand, I think, sometimes how much goes into this, and it's for the all the stuff that we talked about on other episodes about preparation and stuff that goes into this. So not to belabor it, but I think of all the stuff that we've talked about today, there's definitely some beauty stuff. Making sure you go to the right person. I we can talk about it another day, but I don't think people realize how much training, time, effort that beautiful G-Berto and just Sarah have put into training and doing lips and those type of things. So super, super important. But let's get into some fun part here. Maybe a little factor or fiction.
Let's do it.
Factor or fiction? I feel like I'm just.
He looks worried.
I know.
G-Berto just started sweating.
got so scared.
I mean, some of
His
it
face
was
expressions
just locked
today
some of
are
it I got ahead of myself. Factor or
amazing.
fiction? You've had multiple parties that you have forgotten to invite your best friend to.
I'm going to say fact, but it's not because I forgot. It's because they weren't my necessarily parties to be able to invite you to.
You didn't get a +1?
I had my +1.
Ooh, and that is
I'm not
you
gonna say
anymore,
I'm not
man.
gonna say that there's a
not
dagger
you.
here, but
16.
we'll just rotate this seat for those of you that are just listening. I'll look at Sarah and the he who shall not be named to the left of me.
Can we make him just Gilberto then?
It's
Because
just
he's
Gilberto.
calling me. And the
Beautiful.
beautiful
Gilberto.
Sarah. We just changed
Bam,
roles.
just like that, just like that.
I see how you are. Yeah,
Fa-
just jump on that little.
Beautiful Sarah.
Factor or fiction, Sarah. Lips is your favorite procedure.
Correct. Yeah, fact for now.
Oh.
Yeah. Cheeks are coming in second for me, actually.
Okay.
I've really enjoyed cheeks recently, but lips are my go-to.
Okay, cool. Can we do, because as you guys who listen religiously, I appreciate it, number one. But two, behind the bovie, can you both give me a little something that people don't know about lip augmentation, a little behind-the-scenes action that people wouldn't know?
Gilbert?
Just Gilbert, anything you can add to
Just
this?
Gilbert? Do you have a...
It's something that we've kind of touched on in the past is, I will sometimes offer different options of anesthetic to help ease the discomfort of lip injections, from topical numbing to dental blocks to just kind of numb basically the whole area. And a lot of patients seem to like that. I know you guys offer Pronox at your practice.
We do. It's a nitrous gas that helps just release some of this, help the lips go a little bit numb. Sarah, a little behind the bovie?
In relation to lip injections, I think that aftercare is important. Just kind of setting the patient up for what to expect, having the right tools in their toolbox for the few days afterwards post-injection.
I thought one that you guys that you mentioned earlier and didn't mention now, the subtle watching people. I think that's one that people don't realize that you're doing the entire time, because that helps with some of the person, the animation, the other stuff. And I think most people don't realize that. I thought that was a golden nugget that one of you guys mentioned, and a really good one.
Beautiful G-Berto was the one that.
You mean just G-Berto?
Just G-Berto.
What? Can we do a quote of the day? I don't even know who to look to. Just G-Berto or Celebrity Anesthesia?
I've got one for today.
Let's go to Celebrity Anesthesia, because G-Berto's dead to me.
Pretty topical with the coronavirus and everything going around. There's a lot of fear and panic. Marie Curie said, "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less."
Love it.
That's great.
I think it's super important because there is a wealth of information out there. Obviously, you gotta figure out where your source is and where that's coming from. But we need to be learning as much as we can about this virus, about the spread, about the disease process, and how we can decrease the risk of contaminating others, putting the at-risk population at higher risk. And if we can do those things, we'll be able to control this and move forward.
Absolutely.
I also think that this is going to be a learning experience for all of us. I think we talked about it on those of you who didn't listen to on our virtual online appointment podcast about how taking what we learned from this to move medicine forward. The world has become a very small place. So this idea that things are going to be isolated in a certain country, a certain town, those days are long gone. And if you don't know that, you're living under a rock, and the world's only going to get smaller. So I think there's so many things we're going to learn coming forward. For all of us in this room who are super young, this isn't going to be the last crisis in our lifetime that we face. And so I think
historic times that we're living in right now.
It is historic. But you know what's beautiful even about this whole thing, and I like to just see the positive in everything, is how united I feel like the world is right now. I think we're all going through the same thing. We're all kind of experiencing some of the same things. And so it brings people together. And I think really if we can focus on that and being positive and helping each other and loving each other through it, and being sensitive, that's the most important thing that we can do, and really use this time to grow, as a nation.
Can you send that message to producer Donald, who had three carts of toilet paper, and he was being the horror that you saw in Walmart?
Well,
so
let me tell you, I'll go to his house for some toilet paper when I run out. That's what's going to happen.
I wanted to thank all of you for being on the podcast. I thought today was really pretty incredible to kind of do some myths about lips, and I want to take this time to ask all the people listening, if you enjoy this, if you're watching on YouTube, tell a friend about it. Yeah. Make sure you guys know you can download this on iTunes. We're now on iHeartRadio.
Yeah.
Whoa,
That's what I'm talking about. You're welcome.
Boom, boom.
You can also listen on Spotify, Pandora. So wherever you get your favorite podcast, download us, Plastic Surgery Untold. Thank you, guys. #1 podcast as voted by G-Berto, just G-Berto's mom. Thank you.